Hi, I'm Joanne Rinker, Director of Practice and Content Development at AADE. Today I have Asha Brown with us. Asha is the founder and executive director of We Are Diabetes, where she works with families, patients, and health professionals across the United States. She uses her personal experiences with ED, DM type 1 to offer hope and support to the thousands of individuals struggling with this deadly dual diagnosis. She also establishes relationships with eating disorder treatment programs and diabetes organizations across the country to help connect people to appropriate care. Asha has presented at NEDA, JDRF, AADE, FENCI, among others. So today I'd like to tell you a little bit about the mental health practice paper that we have on our AADE website, and then talk a little bit with Asha about that paper. So one thing I want to tell you a little bit about that paper is that there are three real key things that is reviewed in the paper, which is the relationship between diabetes and mental health, how medications can really affect cardiovascular health, and then also really knowing how to refer. So let's first reach out to Asha. Asha, why don't you tell us a little bit about yourself and a little bit about We Are Diabetes?
Sure. First of all, thank you for having me today. So I have lived with type 1 diabetes since I was 5 years old, and I spent a third of my life at this point struggling with a very dangerous eating disorder. And I'm still, to be honest, surprised that I'm alive to talk about it today. I struggled with something that is very specific to the type 1 diabetes community, where you omit or skip your insulin injections in order to lose weight rapidly. It's unfortunately a very common practice that is slowly getting some awareness, but not enough. And I think one of the major problems that we're facing right now as a community within the diabetes world is teaching healthcare professionals how to support these patients, which is, lo and behold, why We Are Diabetes exists, so that we can help support not only the great number of people, unfortunately, who are battling this, but also the healthcare providers that want to help better support this population.
And can you tell us a little bit about how diabetes and eating disorders are related?
Sure. So, and this is specific to type 1 diabetes, and I want to make sure that the reason I want to preface this by saying I work from the population of type 1 diabetes because I am myself a type 1 diabetic, and so I don't want to speak for all people living with diabetes simply because I don't think that's fair, and I'm coming from the personal experience and the experience of my clients. So with type 1 diabetes, there is a lot of emphasis, obviously, on food and numbers and control. Although we don't like that, we're all trying to get away from that word, it's still in our mindset, and it's going to take many years, I feel, to reverse the damage that was done in the 90s, where that word was everywhere and it was spoken by everyone in the healthcare world in regards to diabetes management, right? We're all trying to get away from it, but it's still there. So because of this almost necessary emphasis that is needed in order to manage your type 1 diabetes properly, and this hyper awareness you have to have about food, it can create a very unhealthy focus on food, numbers, and control. There also is a really large psychological and emotional effect that comes when you have to live with such a demanding chronic illness. It's really important for everyone to understand that you can develop an eating disorder living with type 1 diabetes at any age. I mean, it can happen as a teen, even if you, just like me, have known no life beyond type 1 diabetes, or it can happen later in life. There's no specific demographic of people that are more prone to getting it. I have clients that are young, and I have clients over the age of 65, unfortunately, with a various type of disordered eating and co-occurring type 1 diabetes.
So this is really interesting, Asha. Thank you so much. What are some signs or symptoms that we should be looking for that may be associated with diabetes-related eating disorders?
Sure. And I want to also preface this by saying this is not an exhaustive and total list, but these are some of the common signs and symptoms that have been noted by multiple treatment centers that have specialized programs, as well as people like myself who worked with this population. So if you're noticing rapid weight loss or weight gain in a patient with type 1 diabetes, that can be a marker. The way they talk about themselves, low self-esteem or preoccupation with their weight, or preoccupation with taking only a certain amount of insulin, you know, like trying to restrict a certain like goal of how much insulin they should be taking, hoarding food, unwillingness to follow through with sharing their information with their providers on their diabetes. Obviously, there's the big one, reoccurrent episodes of DKA, you know, that's a big sign, but I don't say that as the first sign and symptom, because I have many clients who have an eating disorder that is not specific to insulin omission. So their A1Cs are not terrible, right? I mean, their diabetes is suffering, but they have a different type of eating disorder. Low energy, fatigue. I mean, there's a lot of signs and symptoms that you will notice of a patient feeling unwell. And this kind of leads into something I know you and I will discuss in a moment here. That's why it's so important to be asking the right types of questions when you suspect or see a certain sign or symptom occur in a patient.
Yeah, so if the diabetes educator is seeing this, they're seeing some things that might be those signs and symptoms. What is the best way for them to address this? Like, what are some key questions that they might ask?
So I want to also let everyone know that I did just throw this resource up on We Are Diabetes, and I shared the link with someone at AADE. So if people are interested and curious, we will be able to share a specific list of open-ended questions you can have to ask if you do have a patient you suspect might be struggling with this. But I will list a few of them here. Questions like, how much of the day are you thinking about weight, body shape, or size? Do you ever feel that you are out of control in your eating? Do you ever feel guilty after eating? Do you have a hard time figuring out how much insulin you need to be taking? Or is it just hard in general for you to be taking your insulin, and why? As you guys can see, all of these questions, you get a longer response than yes or no. So you want to avoid questions that are just going to give you a yes or no response, because that's not going to give you enough information. Other things like, this is a good one to ask. Is it hard for you to take your insulin sometimes? Why? Do you ever only take half of the amount of insulin you're supposed to be taking, and why? I mean, you have to be asking these, and it might feel a little uncomfortable at points to be feeling like you're prying, but if you suspect that one of your patients is struggling with this, it's better to offend them and ask these questions, you know, so that you can help them sooner, that they don't have to suffer for a decade like I did.
Yeah, and get help. I love it. So then, Asha, sort of our last question is, where can people go, people who are affected by eating disorders and diabetes and that relationship, where can they go for help?
Sure. So one thing that I spend a great deal of my time doing with We Are Diabetes is making connections with credible treatment programs across the country that have the education and awareness and the staff in place, the specific type of staff like a CDE, in their programs to treat type 1 diabetics with eating disorders in a safe and effective manner. Unfortunately, there are treatment programs out there that say, sure, we can help them. And that's just not the case. And unfortunately, if you refer your patient to a program that does not have the capabilities, it can be dangerous, really dangerous. And it can actually exacerbate their symptoms and make their eating disorder worse, as well as put them in a dangerous position with diabetes management. So We Are Diabetes has a wonderful list of treatment programs that we absolutely trust, and many of them partner with us. If you go to wearediabetes.org and look on the recovery section, they're all listed right there. And we are also happy to connect with anybody personally. If you contact us through the website, we can give you more information. We can even do email introductions to the admissions team.
Wonderful. Thank you, Asha. So before we wrap up today, let me just first see, is there anyone who has any questions that they would like to ask Asha before she goes? It looks like we have no questions. Okay, so I want to thank everyone for joining us. I want to encourage you to go to www.diabeteseducator.org / mental health and check out the mental health practice paper, which does have a big component around these sort of diabetes related eating disorders. I want to thank you, Asha, for joining us today, and for everyone else who joined us on our Facebook Live, and hope everyone has a great day. Bye, everybody.
Thank you.